Welcome back to Studio 701. You may not love going to see the dentist, but it's pretty important. You really shouldn't put it off.
Natalie and I got to sit down with Dr. Sid Schmidt from Prairie Rose Family Dentist and talked about when it's time to get a new crown. How does someone know it's time to get a crown restoration? What is that?
Well, typically what happens is, we all know people, or we've had fillings placed in our mouths at a young age. And as the years go on, the larger the filling that's typically in a tooth, the weaker the tooth becomes. Over the years, there's a lot of wear and tear. And many times we'll see these large silver fillings that are placed, when people are in their, in their teens or in their childhood years, and they get into my age, and these teeth start breaking down. They start getting weak. They start leaking, and it's not so much of the filling that's the problem. It's the weakness in the tooth and just the years of using that tooth. And typically, when it gets to a point where studies will show 50% of the tooth that's filled. If it's greater than 50%, there's a 90% likelihood that that tooth will break or fracture or have some issues down the road. So it's important to visit with your dentist about that and to be aware of what's going on so you can try to kind of head off the problem before it gets worse, because many times these teeth will crack or they'll break at inopportune times, or they'll fracture into the nerve, and then you'll start having a toothache, and it could lead to a root canal or potential tooth loss. So it's better to be proactive, especially if you have these large restorations. Make sure you have your dentist look at that and inspect it and see if there's any issues going on, any potential cracks or problems. That way you can discuss some options for restoring that tooth for the long term. Some things I'll tell most of my patients is, if you're noticing every once in a while you'll hit on a tooth and you'll get like a zing, or you'll have a hot and cold sensitivity that'll happen and it'll go away. That's the time that you want to definitely get it addressed and looked at, because unfortunately, one thing to watch for is if you're having a tooth that's real cold sensitive or temperature sensitive, and that sensitivity lingers for a period of time, doesn't go away right away, or if the tooth starts to hurt on its own, you wake up in the middle of the night with pain, there's a strong likelihood that that nerve in that tooth is declining and potentially moving to an abscess, and where you are going to have a real bad toothache, and get it definitely looked at and checked out, because it may require a root canal or some treatment like that to save the tooth.
So when a doctor brings up a splint, what do they mean by that? Because
Sure.
I've heard that term before.
Sure.
It sounds a little scary.
Yes, well, and it's not, but the funny thing, I shouldn't say it's funny because it's really not funny, but as the years have gone on, what we've started to see a huge correlation with tooth wear and sleep issues. So, we used to say, oh, I grind my teeth at night, or, my husband or wife grinds their teeth at night, they must be stressed out, which, stress does play a role in that. But we are finding a huge correlation with sleep issues, sleep apnea, snoring. Because when you're trying to sleep and you don't get the proper air, you have to reposition your jaw in a different position, and you might start grinding your teeth because you just can't breathe. You're trying to find the position to breathe. So there's a lot of research, and there's a lot of studies showing that. And I've had patients that have come in that have extremely worn teeth, and for years we were thinking it was due to stress or clenching their teeth. And it turns out that they went in for a sleep apnea test, and once the sleep apnea test was performed, they found out that they did have sleep apnea. They started using a CPAP, and then basically their grinding disappeared. It went away because they were able to breathe at night. So all that plays into total health for a person. If you don't get your sleep at night, you're not rejuvenated, you're not feeling good the next day. That all has a domino effect with strokes and heart attacks and issues, dementia, which is also linked to that. So the splint, people that cannot tolerate CPAP, there are options with your dentist we can actually fabricate an appliance for you to wear at night to reposition that jaw in a forward position to open the airway. So that's where the splint therapy can come in. And some people, if they go through the testing and they are actually, sleep apnea has been ruled out, then we may look at some type of an occlusal guard or a bite splint to wear at night, so that'll kind of help prevent them from doing more damage to their teeth. I'd rather see a person damage or wear down a bite splint than to actually damage their teeth. Some of the advancements in dentistry is the technology as far as digital impressions, same-day restorations that we're able to do. We talked about crowns a little bit ago. Traditionally we used to have to take impressions and send to a dental lab. Now, and we've been doing this for many years, we can actually digitally scan a tooth and design it on site and make the crown and place it right at that first appointment. Because people are busy, their lives are hectic, and to make multiple appointments to go see a dentist, we try to streamline it as often as we can.
And make sure you go see Dr. Sid Schmidt or any of the dentists that are located at one of the 3 Prairie Rose Family Dentist locations that are listed on your screen.
All right, still to come on City